If you're dealing with eczema, you're probably all too familiar with the itchiness, dryness, and sometimes painful flare ups that come with it. Finding the right medication can feel like a long, frustrating journey, but it's not impossible. Thankfully, today there's a range of options available, from over the counter creams to prescription treatments, each tailored to different levels of severity. Let's dive into the common types of eczema medications, how they work, and some tips to help you find the best fit for your skin. Eczema. Why is it so stubborn? Before we jump into medication, let's get a quick overview of eczema. Eczema or atopic dermatitis is a chronic skin condition that causes inflammation, itchiness, and dryness. The symptoms can vary from person to person, and while there's no cure, the right treatment plan can significantly improve your quality of life. A big part of eczema's stubbornness comes down to its connection to the immune system. When you have eczema, your immune system tends to overreact to irritants, allergens, or stress, leading to that familiar flare-up. So the goal of most eczema medications is to calm down the immune response and relieve the inflammation and itchiness. Over-the-counter options. If your eczema is mild, you might find that over-the-counter products are enough to manage it. These are typically the first thing doctors recommend because they're accessible and have a lower risk of side effects. Number 1. Moisturizers. Moisturizing is probably the most crucial part of any eczema care routine. The right moisturizer will help lock in moisture and protect your skin barrier. For eczema, look for products labeled as ointment or cream rather than lotion, as these tend to be thicker and more effective at keeping moisture in. Popular choices, brands like CeraVe, Eucerin, and Aquaphor offer affordable dermatologist-recommended options. Number 2. Hydrocortisone creams. Hydrocortisone is a mild steroid that can be purchased without a prescription and is often effective for mild to moderate eczema. You'll find it in various strengths, like 1% being the typical over-the-counter version. Hydrocortisone creams help to reduce inflammation, which eases itching and redness. When to use. If your eczema is flaring up but isn't severe, applying a thin layer of hydrocortisone cream can help. However, you should avoid using it for more than a week at a time without consulting a doctor, as long-term use can lead to side effects. When OTC isn't enough, here are other prescription options. For more persistent or severe eczema, your doctor may recommend prescription medications. Prescription treatments come in various forms, including stronger steroids, non-steroidal creams, and even pills. 1. Topical corticosteroids. Topical corticosteroids are the most commonly prescribed eczema medication. They range in strength from mild to very potent, with different types available depending on the severity and location of your eczema. For instance, delicate areas like the face require milder steroids, while thicker skin, like on elbows or knees, may tolerate stronger options. Pros and cons. While steroids are effective at reducing inflammation and itching, they come with some potential side effects, especially if used long-term. Skin thinning is one of the most common side effects, so it's essential to follow your doctor's instructions closely. Number 3. Topical calcineurin inhibitors or TCIs. If you're looking for a non-steroidal option, your doctor might prescribe a topical calcineurin inhibitor like tacrolimus or pimecrolimus. TCIs work by suppressing the immune response in your skin, which can help reduce inflammation and itching without the risk of skin thinning associated with steroids. When to use. TCIs are often recommended for people who need a long-term solution for sensitive areas, like the face or eyelids, where steroids use should be limited. However, they may cause a temporary burning or a stinging sensation when you first start using them. So don't be alarmed if you notice that. Your skin usually adjusts over time. Newer options for treatment. In recent years, there's been an exciting wave of new treatments for moderate to severe eczema that take a different approach by addressing the immune system more directly. Number 1. Biologics. Biologics are a newer class of medications that target specific proteins in the immune system that contribute to eczema inflammation. Dupilumab is the first biologic medication approved for moderate to severe eczema. It's given by injection usually every other week and has been shown to help reduce both itching and skin inflammation. Who's it for? Biologics like Dupixent are generally prescribed for people with severe eczema who haven't responded to other treatments. It's also a popular option for people who want to avoid long-term steroid use. Number 2. Janus kinase or JAK inhibitors. JAK inhibitors are an oral medication that works by blocking the pathways that cause inflammation in eczema. These drugs, such as upadacitinib and abrocitinib, are relatively new but show promising results in reducing symptoms for people with moderate to severe eczema. What to expect? JAK inhibitors might work faster than other options, making them appealing for people who want rapid relief. However, they are usually reserved for cases that haven't responded to other treatments, as there are potential side effects that should be carefully considered with your doctor. Sometimes, less is more. Here are some complementary treatments if you don't want medications. For people with mild or well-controlled eczema, some simple lifestyle changes can make a huge difference. Even if you're on medication, incorporating these can help reduce flare-ups and potentially improve the effectiveness of your treatment. Number 1. Stress management. Eczema and stress are closely linked, and stress can often trigger or worsen flare-ups. Incorporating relaxation techniques like meditation, deep breathing exercises, or even a calming bedtime routine can help. Number 2. Avoiding triggers. Common triggers for eczema include certain soaps, fragrances, and even foods. Keeping a journal to identify what tends to cause flare-ups can be a game changer. Once you've identified your triggers, you can try to limit your exposure and see if it helps. 3. Dietary changes. For some people, certain foods may exacerbate eczema symptoms. While everyone's different, some people find that cutting back on dairy, gluten, or sugar can make a difference. Talking to a dietitian can help you navigate these changes. In finding the best treatment, take these in mind. Choosing the best medication for eczema can feel overwhelming, especially with so many options. Here are a few tips to make the process a little smoother. Start with a patch test. If you're trying a new cream, start with a small patch of skin to see if it causes any irritation. Follow doctor's advice closely. If you're prescribed a steroid, it's important to follow your doctor's instructions closely to avoid side effects. Be patient and persistent. Finding the right medication might take time, and you may need to try a few options before you discover what works best for you. Ask about combination therapy. Sometimes a combination of treatments works better than a single medication. For example, you might use a steroid during flare-ups and switch to a non-steroidal treatment for maintenance. Finding the best medication for eczema can take some trial and error, but remember that you're not alone. Eczema is a common condition, and there are options out there for you. Whether it's a trusted over-the-counter cream, a prescription from your doctor, or even one of the newer immune-targeting treatments, the right combination can help you live more comfortably. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life.